When I was 15, I had a suicide attempt.
I decided that I wanted to die by suicide. I was 6, maybe 7 years old.
I saw him in October, and then we lost him in November.
Whatever the reasons, we know there's a mental health crisis among you.
We have to understand that suicide is an urgent public health problem.
We're seeing a lot of youth that are struggling, and a lot of the factors are kind of the ripple effects of the pandemic.
There are ways to end or minimize your pain without ending your life.
I'm so thankful. They saved my life, truly.
We now continue our in-depth report on the tragedies of suicide. According to the National Institutes of Health, the stresses of the pandemic may have contributed to an increase in adolescent suicides. We head to Connecticut Children's in Hartford to explore how the hospital is responding.
It was a different time, and so there was a lot of stress in the family.
Steve McCaddy speaking out to make a difference, detailing the struggles he's had inside ever since he was a very young boy, experiencing trauma at home.
Somewhere in there, I believe, I decided that I wanted to die by suicide. I was 6, maybe 7 years old.
McCaddy tried to smother himself. He spoke to his mother, but she didn't take his actions or feelings seriously.
For her, that conversation never came up again. For me, it was the beginning, and it continued, and sometimes still continues to today.
While this man's story may have been unique years ago, it is not today. Children are having suicidal thoughts younger than ever before, shown in data collected by the Centers for Disease Control and Prevention.
Suicide is now the second leading cause of death for children starting at age 10. Starting at age 10. That's a nationwide phenomenon, but it's one we see in Connecticut as well.
In October of 2020, the state's Office of the Child Advocate issued this alert after 4 youth suicides in 1 month. Advocate Sarah Egan says the pandemic exacerbated existing problems.
We have been moving towards crisis for a long time now.
Every patient that comes to our emergency department that is 10 years or older is asked the ASQ, or Ask Suicide Questions screener, and it is a validated tool that helps identify patients at risk for suicide.
That's universal screening in the ER at Connecticut Children's in Hartford when a child comes in for any medical issue, be it a mental health problem or a broken bone. Dr. Stephen Rogers is the medical director for emergency behavioral health.
In the first 2 years of our screening program, we screened well over 30,000 kids, and about 17% of them were positive.
The world's so different now. I mean, would you want to be a teenager now?
No.
No.
Melissa Santos is the division head of pediatric psychology at Connecticut Children's.
We have to start looking at some of those populations of kids that are just at more risk for suicide, depression, and anxiety, and those have tended to be in the pandemic our Black teen girls and our transgender youth.
Traditionally, young white males have been most at risk, but that landscape is changing.
When we think about the impact that COVID has had on some of our kids, the number of kids who have lost their primary parent or caregiver to COVID death has been outstanding, and it's been significantly higher in our Black population.
A result of more responsibility at home and racial tensions in our country. For many transgender youth, it was difficult to be stuck at home during the pandemic, where they weren't accepted or understood.
A lot of organizations closed down, people's support systems went away. Perhaps school was a safe place for you. Maybe that's where you saw the school counselor, or you had your supports in place. That all got lost in the pandemic.
This is a moment of reckoning. And what are we going to do about it?
Santos suggests not just talking about mental health in reaction to a bad event. Instead, discuss it often.
I think that every place that a child goes, we talk about emotional health. When they go to the pediatrician, we talk about emotional health. When you go to the dentist, you talk about emotional health.
Talk about what's going on. Don't be afraid.
Over his life, McCaddy, now a husband and father, has had 3 serious attempts and even lost his brother to suicide. He continues to see a therapist to this day, and believe it or not, became a therapist himself, working mainly with kids.
I will stand by you. I will help you through.
He finds freedom when he sings, not afraid to say he's a work in progress, working hard every day.
I will dry your eyes.
And I think anybody has something great, and I would like for them to be able to stick around and find out what that is.
Really powerful words there. And tomorrow we take a look at resources where you can turn if you or your child is struggling. And when are children the right age for this conversation? It might be younger than you think. And if you are in need of help, call the Suicide and Crisis Hotline at 988. Really, we are just so thankful to the folks who are sharing their brave stories, making such a difference here with us.
Yeah, you mentioned 17% of these kids test positive in this screening. Is that a big number? And then what happens to those kids? How does it play out?
I think it seems like a lot, and at least that means that they will have attention on them. They will get the attention and perhaps the treatment, if they need it, that they deserve.
Yeah, valuable. All right, Sarah, we'll see you again tomorrow night.
Thank you so much.
Coming up here.